everyone. This is Muzna from the American Stroke Foundation. Welcome. Today we are talking about emotional health, and today's Q&A is part of the American Stroke Foundation's virtual Next Step program. The Next Step program focuses on brain and body health after stroke and supporting caregivers and stroke survivors in their journey towards wellness. So welcome. If you're new, if you're visiting us again, please let us know. Let us know where you're from. We always like to hear that. Okay. So emotional health, we are talking about taking care of your feelings after a stroke. The emphasis can be on physical health and physical function, and sometimes emotional health can fall by the wayside, which makes it even more challenging because a lot of us have, things that we are dealing with or aren't dealing with even before the stroke. And then having a stroke just kind of brings everything to the surface or makes things that are already challenging even more challenging. So please share with us any questions or comments you have about your stroke experience and how your feelings changed after, like what happened right after, how that changed as you went through rehab, how your experiences changed as you kind of settled back into your life, and also as caregivers or family members of someone who's had a stroke, please also join us with your questions and comments so we can support each other. So after a stroke, we can have the stages of change and grieving, just like you would to any other life-changing event. You can have denial, anger, bargaining, depression, and acceptance. You don't have to go through all those in that order. You may not go through all of those on their own. But I think the biggest thing, or the thing I want to really kind of emphasize as a preface to this discussion, is that all feelings are valid and all feelings are okay, right? You need to feel your feelings. When those feelings get in the way of you doing what you want to do and things that you love or things that you need to do, or if you have feelings that affect, you have thoughts about hurting yourself or others, that's when you need to seek support, okay? All feelings have a purpose. It's what we do with them that matters. So definitely get your medical team in place before it becomes a situation that you can't handle on your own. So you always want to make sure emotional support is part of your healthcare plan. So who would like to start off with questions or comments about their experience? A lot of times we use words like anxiety and depression to describe how we're feeling on a daily basis. It's important to remember that those words are specific diagnoses, and they have very specific criteria, right? So a lot of times when people are using those words, they're talking about components within those diagnoses that they're experiencing. So again, it's normal, it's okay, and it can be expected to feel have feelings of sadness, or to have feelings of anxiety, or to have feelings of anger. It's what we do with them and how they impact our day that makes the biggest difference. So how is emotional health different than physical health in terms of if we don't pay attention to it? So if we are not taking care of our bodies, we know it, right? Something starts to hurt, or we're no longer able to do our activity, or we're uncomfortable. It's very obvious. Like if we look down at our arm and we see that it's not moving as well, we can look at our arm and see that. But when our feelings change, we get, not all of us are as aware or in touch with our emotional side as we are with the physical side. So we have routines and habits on how we deal with feelings based on how we grew up, based on our experiences as an adult, based on what this, the world around us kind of supports, and those carry over after a stroke too. So if you didn't talk about things, all of a sudden to expect that you're going to talk about your feelings in a support group or something after a stroke, that's not realistic, right? You want to meet yourself where you are. So what were your outlets before the stroke? How did you recognize signs of getting overwhelmed or signs of being in a funk? And how did you cope with that? How did you process those feelings? And that's how you want to approach your emotional health toolbox after the stroke as well. That isn't to say you can't learn new strategies and that your prior strategies prior to the stroke are going to be just as effective. It just means that you have a baseline and you need to go by your baseline. There's no right or wrong way to approach that. Usually we think about like, oh, you know, I'm not a talker, or I don't want to talk to a mental health provider, or I don't want to join a support group, I don't want to talk about my feelings. And that's okay. Talking or talk therapy, or however you want to label it, is not for everyone, and that's okay. I think sometimes the pressure to start there can sometimes scare people away, or have people like lose a possible connection. There are lots of ways to process your feelings that don't involve a back and forth dialogue. Music and art therapy are examples of that, but also doing things in nature, so gardening or going for a walk, just connecting to something bigger than yourself is one example of a way that you can process those feelings without having to like do the back and forth dialogue. So we've got some comments and questions coming in. Alyssa says, I am being very emotional. So that's something we hear a lot after a stroke. And, you know, it can be multifactorial. Alyssa, if you want to share any specifics or if you have any questions, please let us know. But in general, know that that is not a uncommon experience. Depending on when your stroke was, you could still be adjusting to that actual life change. Then there's also like chronic adjustment challenges that can lead to being very emotional. And then there's some ways that the brain changes after a stroke, right? So your threshold for what you can process and handle in a day may change. Sometimes people may notice that they cry easier, or they laugh when in situations that may not necessarily be the most appropriate to laugh in. And those are just changes in brain chemistry and kind of those filters that we have set up in the frontal part of our brain. So being very emotional, I think, is know that you're not alone in that experience, and you know, find your safe person and kind of bounce your ideas off of them, or make sure you have something on a daily basis that kind of gives you a break from that. So sometimes people schedule like a worry time, and they journal, or they spend half an hour kind of writing down the thoughts that are kind of going through their mind that makes them emotional, and then they put that away, and your brain knows that, hey, I've got a place for this, I've got an outlet for this. I don't need it to be running through my head 24 hours a day. But that's something that takes practice. LaShawl says, I'm afraid to go to the doctor because last time I went to the neurologist, they said, why did you go to the hospital? There's nothing wrong with you but anxiety. Well, I'm sorry to hear that experience, LaShawl. That's a really not helpful comment, I would say. And if you went to the neurologist, are you saying that like you thought you were having a stroke, or you thought you were having a recurrence and they said it was just anxiety? Anxiety is a tough one. Anxiety is notorious for making us feel things that feel like something else is happening. So a lot of times with anxiety, people can feel like my heart is racing, I feel like I'm having a heart attack, or I can't catch my breath and my speaking is affected, I'm having another stroke. Or it can make your, it can make your stomach really hurt and have an upset stomach kind of symptoms. And you would swear, you would put money on it that it is another stroke, or it is a heart attack, or it's something more. And the culprit ends up being, if not anxiety, a big part of it. Now, I'm not saying that was in your case. I'm just trying to kind of brainstorm on why that kind of is a response. Especially if you're going in after you've already had a stroke. So that experience definitely doesn't make it any easier. However, you want to continue to be your own advocate, right? You know your body the best. It's better to be safe than sorry. Make sure you talk to, if you've had a stroke, talk to your neurologist or your PCM about, what is my risk factor for another stroke, right? When should I be concerned, and what symptoms should I be looking out for? Because the symptoms may be a little bit different magnitude for a recurrent stroke than the initial stroke. But never hesitate to call 911 or go to the ER, or call your emergency contact if you feel like something is wrong. Always better safe than sorry. And if if it is anxiety and it's to the level that it makes you feel like you need to go to the ER, then that's something that needs to be addressed too, right? Regardless of whether it's being accompanied by another neurological event. So take care of yourself, okay? Alyssa says, we walked with the dogs on a sunny day. Today is raining. Yep, walking with the dogs is great. There's kind of like a built-in wellness system. Getting sunlight is important. Within 20 to 30 minutes of waking up, or at least within an hour of getting up, you want to get 20 to 30 minutes of natural sunlight. That's important not just for resetting kind of our sleep-wake cycle, but it's important for mood regulation as well. Sun on your face will do wonders. So if for some reason you are unable to go outside without help, or going outside is a little scary or challenging for whatever reason, try to sit by a window, go out on your balcony, go out with a friend. But getting that sunlight is very important. It's a big part of the foundation for wellness, emotional wellness. Alyssa says, my first stroke was 2018. I had another absent stroke last May. Okay, so it sounds like you're dealing with a chronic issue there. So, Alyssa, what kind of supports do you have to take care of your mental health? LaShawn said, I had new symptoms with speech and dizziness and difficulty walking straight. I tried to tell her. She shut me down and waved her hand and just said anxiety. Yeah, time to get a second opinion, especially if you're at a high risk for a recurrent stroke. Lifestyle modifications are a big part of secondary stroke prevention. And part of lifestyle modification, in addition to moving your body and nourishing your body with food, is taking care of stress. And stress is not, again, stress is your body and brain telling you something. It's not a bad thing. Stress keeps us moving and active, and our body putting resources where they need to go. But chronic stress will definitely can cause illness independent of any other risk factor. So you definitely want to make sure you have an outlet. Something I say when it talks about, when I think about emotional health is, I think we've all heard that, if you're thirsty, you're already dehydrated. Same with emotional health. Like when you feel anxious or sad or frustrated, things are way activated on the inside. So it's good to, just like drink water throughout the day, take care of your feelings throughout the day. Pay attention to what makes you feel good, what makes you feel stressed, what makes you feel neither, and make sure you have a balance, or the best balance that you can get. And if you're having trouble with that, then talk to your friends or talk to someone you trust. But balance is key. We need enough of the good stuff to keep us on the right track, including the physical recovery. All right. I kind of want to ask Alyssa for pictures of her dog. Don't you have to do that? Isn't that mandatory? LaShawn says, I've had 2 strokes in less than a month. Sylvia says, I'm a caregiver to my husband. His stroke was 15 years ago. I only learned recently from his podiatrist that stroke survivors are extra sensitive to pain. For example, my husband has always said ouch when I'd simply change his shirt. Anyone else experience this? Sorry, we're going to chime in if you can relate to this experience. But hypersensitivity is one that can be a symptom after the stroke. So it can be, the actual sensation of the shirt on his body is overwhelming, or it could just be that anything, touching his skin. It could be a nerve issue, and his body is just responding to any stimulus that way. But desensitization is really important. So if a shirt is uncomfortable, experimenting with different textures, like a really soft t-shirt or a soft blanket, and having him do as much as possible so that he knows when the contact is coming, are some strategies to try with that. But you definitely want to, you don't want to kind of push your way through it. You want the skin and the brain to get used to that input. So definitely experiment with different types of t-shirts, especially like softness, but also practice those areas where he especially feels sensitive or says ouch, massaging lotion or letting warm water run over it, just, sensations that are under your control that have a pleasant association can help separate that pain experience or that ouch experience with putting on a shirt. You don't want those two things to be permanently connected in your brain. Alyssa, you said I have diabetic. The nurse practitioner called the ER because she noticed that I was having a stroke. I'm glad she was able to recognize the symptoms. Alyssa also said I had a heat stroke, there was hot sunlight, and I was dehydrated. Daniel says I'm very sensitive too, in response to Sylvia's comments. So what are some strategies, Daniel? Do you have any strategies you want to share for that sensitivity? So while we're waiting for more questions, keep them coming, questions and comments. How are you taking care of your feelings? How you dealt with the change right after your stroke? Did you have support? What, looking back on your experience, what would have made the biggest difference for you? Did you have someone who talked to you about your emotional health when you were in the hospital? Or was it just your doctor and your nurse and your rehab team? Was anyone taking care of your feelings? We'd love to hear from you. So, feeling your feelings. So, they will, we all have things that we need to get done during the day. Stopping to kind of feel our feelings is not always in the plan for the day. However, the body, there's a book called The Body Keeps the Score. And I love that title because if you don't pay attention to your feelings, if you push them down, if you save them for another day, if you ignore them, it will come out in another way. So a lot of times people experience physical pain that gets aggravated when they're holding in a lot of emotions. Sometimes people notice that their frustration tolerance has decreased. All those things can have emotional wellness tied in, right? Because it takes a lot of energy to hold things in. Even if you don't think you're doing it consciously, the unconscious effort will show up. You'd be amazed at, stories you hear, and if you talk to medical professionals, if you talk to family members who've had chronic illness or even other stroke survivors, that when they start taking care of their feelings, like other things start falling into place a little bit easier. It is very challenging to get the full benefit from physical wellness, things focused on your physical wellness, if your mood is not being taken care of, if your emotional health is not being taken care of. That is such a stressor for the body that resources will go towards that. And that means you have less to do the other stuff. I think if we reflect a little bit, we could all reflect on days where, we wake up, we slept well, we're looking forward to what's going on in the day, and everything else kind of, gets done. But if we're having a day where we don't wake up on the right side of the bed and the morning doesn't go its way and you're stuck in traffic, it affects the rest of your day, right? Before you even get to the stuff that matters. So definitely, the body definitely keeps score. So that is a book that focuses on the effect of trauma on the body. But it definitely has messages and themes that I think are powerful and important for anyone who's experienced a life-changing event. Okay, I'm gonna go up to some questions. Aaron says, I didn't know who to trust, especially myself. Yeah, that's a powerful comment. What I hear or what I think of when I read that comment is, you may be getting signals from your brain that are different than other people. So people could be saying that, the words you're saying aren't making sense, but in your head they're making sense. Or if your body's affected, you may think that your left arm is doing more than it actually is. And that's tricky. It's disconcerting, right? You're hearing two different messages. You have a perception of how you're doing and who you are, and then some people who are close to you are telling you that that is not the reality. So that definitely, brings up trust issues. And then also trusting yourself, right? If your body is not giving you the same feedback that you're used to, let's just use, hemiplegia as an example. If half your body is not giving you the same feedback and you don't know if you're going to be able to stand without falling, that's difficult too. So I think it speaks to the importance of at least someone giving you space to kind of process those feelings. So Aaron, I hope you found that for yourself, and I hope things are better for you related to that. Alyssa says it's hard to have visitors after the pandemic started. Yep, that is a very common theme. And I think that's part of our goal with the virtual and online is to provide a support network and an education resource that's accessible to everyone. Because, the pandemic has shifted how we approach not just medical care, but wellness in general, right? We didn't realize, I think, the extent to which our daily interactions impacted our health, as small as they were, right? Going to the grocery store, going to your mailbox, having someone stop by to pick up something, all those things shifted. And once all those things shifted and they all shifted together, a lot of people found themselves not feeling as well emotionally. They were out of their routines, they were out of their habits, they were out of their workplaces. They weren't interacting as much as they were. And I think that was the clearest example that we could have on how much who we are and what we're used to impacts our emotional health. And I think that put it into focus for a lot of people, and I hope those lessons are things that we're going to continue to honor and respect as we move forward. Okay. Ressia says, I had a knee replacement 6 months before my strokes. My knee is sensitive. Okay. So your knee is still sensitive from the knee replacement or after the stroke? Your doctor should have given you some exercises to keep that knee ranging, its full range of motion, keep it strong, and also help with desensitization. So Kylie says, can doing things like journaling help with emotional wellness? Yes, 100%. So whether you want to call it, keeping a diary or journaling, or, your worry list, writing things down is powerful. And the reason I use all those different words is because sometimes we have certain reactions to certain words. So it's sometimes you hear the word meditation and you get this image in your head of what someone who meditates looks like. And so sometimes people have strong reactions to words like journaling or diary or whatever. So whatever you want to call it, writing your feelings. is important. It's can be a very value-added piece to your emotional wellness toolbox, partly also because it involves a motor component. You're moving your body, and so it gives a place for your energy to go. So even if what you write down is completely nonsensical, just like stream of consciousness, for some people that can be very powerful, just scribbling, I don't like the word journaling myself, so I just call it, like verbal spiel. And, when I look back at my notebook, sometimes it's like my grocery list, and sometimes it's a list of things that annoy me, and sometimes it's, feelings, but I always feel better after. And that's a strategy I found for myself when the talking part wasn't working for me. So try it. It doesn't have to be perfect. Write it, write things down not with the intent that someone else is going to look at it. Just feel your feelings on a piece of paper and see if that's a strategy that works for you. Alyssa says, I will have a home EEG. That's good. Getting more information is always good about your health. Aaron says, there was what you said, but there were people I caught lying, people I thought were friends. They are gone now. Yeah. It's very challenging when your life changes and as a result of people in your life change, right? You find out who your friends are, they say, in the hard times. I think, and let me know if anyone agrees with this or, even disagrees with this, the stroke doesn't just happen to you. It happens to your family or your spousal unit or your children. It happens to everyone that's a part of your life. And, if you had experience where people were not truthful to you and they were people that you counted on, then, blessing in disguise maybe. But definitely, hurt feelings are part of that. You can have anger and hurt that happened, and you can also miss your friends at the same time. So I think those aren't mutually exclusive. So I hope you found a support network that you trust, and if not, reach out to someone here on the American Stroke Foundation Facebook page or their local support groups. I think someone was asking how do I find support groups near me. You can go to the American Stroke, so Google American Stroke Association Support Group Finder, and you enter your zip code, and it will show you all the local support groups in your area. Alyssa says that aphasia group in Philadelphia. That's great. I'm glad you have that. Aaron McCoy says, yes, exclamation point. I'm assuming that's a positive. You've got your support. Good. I'm glad. LaShawl says, don't understand. LaShawl, what is it that I can clarify? Oh, sorry, I didn't see your earlier comment. I feel like people definitely know or understand some things I do or say after my stroke. I don't sugarcoat my feelings now. If I can get it out, I'm going to. If I feel it's not safe for me or other people, I won't go out. I don't like people telling me I don't think you should do that. I had a stroke, but I'm fully capable of still making decisions for myself. Yes, all, we're adults with decision-making capacity, and that should still be respected. Sometimes, and it's not just in the medical model, but day-to-day life, if you are perceived as being different than how you were, that can lead to a method, that can lead to interaction styles that can be not well received, right? So someone talking down to you or talking to the person you're with instead of you, or not giving you all the information because they think you don't need to know it, making decisions for you. So I'm glad you're advocating for yourself. And then, also your support network, the people that you trust and can confide in them, bounce ideas off of them, hey, I've noticed in this scenario or in these situations, I consistently get misunderstood, or in these situations, people consistently tell me that, my tone was not right or something like that, and get feedback. Sometimes, and it's not just after a stroke, sometimes we're used to ourselves. We don't realize how other people are perceiving us, and vice versa. It's not a blame situation, it's just an awareness situation. So I'm glad you're advocating for yourself, Lashal. Okay, Jill says, my whole life changed in an instant. I suffered alone. 7 years later, still traumatized. It's hard to find help. No group or therapist gets the difficulty of relearning everything on your own. Why are there no groups to join for help and information? That's a good question. I think everyone's experience is so different that it's hard to find something that will meet the needs of everyone. And I definitely don't want that to sound like an excuse or anything. I think that's just a part of it. Do you know, Jill, anyone who's had a stroke, or in your family or any friends? You can also try going to that American Stroke Association support group finder. I'll have Kylie put the link in. And you can reach out to them. But yeah, it is very hard for a medical professional or anyone who's not had a stroke to offer what feels like support coming from a place of understanding. Or maybe I phrased that the wrong way. They care and they want to help you, but no one can understand that experience of having your whole life turned upside down and having to relearn things you took for granted unless you've experienced it. And I think that speaks to the power of social support and peer support. And so questions and answer sessions like this, where we have stroke survivors come together. That's also kind of one of the most important principles or tenets of the American Stroke Foundation, is that everything occurs, in a group format with other stroke survivors. So someone who can speak to your frustrations, but also speak to your accomplishments. So try that stroke group finder. And see if you can get linked up, just to try it. No, not with any expectation other than meeting someone else who's had a stroke. But you're right, and the change, like my professor in grad school always used to say, as soon as you ask yourself, why isn't there something like this, that means that it's your job to do it. The change comes from you. So whatever outlet you have, if you feel comfortable writing, you could write an article for your local newspaper. You could write an article or ask to have a meeting at your local hospital and kind of talk about the support that stroke survivors are missing out on. There are lots of ways to kind of pay it forward and help someone who's gonna who's had that experience after you, and kind of channeling your frustrations into that. But you're right, it's very, very hard to unless you've been there, for things to sound the way you need them to sound, or it's for them to make the difference that you need. So okay, Kylie put in that link for the stroke group support finder. Aaron says, one of the things that I love about ASF is that there are stroke survivors here that may not have experienced what I went through, but they can truly relate. The place is awesome because of the access to other stroke survivors. Thank you, Aaron. I'm glad you had that experience. I think, it's that sense of community, but it's also they've created a safe place for themselves, right? No one can tell you, or no one should tell you, that something is a safe place. Like, you have to judge that on your own. So getting your village together, right? It does take a village, not just for children, but for us too. Getting your village together, and that, the healthcare team is just part of that. But things that keep you active, people that make you laugh, people that, get you out of your house, and people also that will check in on you, some days or some weeks or whatever, it may be a need my own time kind of day, but make sure someone's checking in on you. Those are all parts of emotional wellness. it all starts, I think one of the common themes for all the live Q&As we've done so far is like, oh, it starts with insight and awareness, right? Write down what's going on. What does your day look like? How do you feel? What do you feel like is dragging you down, and what do you feel like is moving you forward? And then work from there. But it takes a lot. It takes work on the front end. And if you need support for that, then that's where, places like the Stroke Foundation are here for you. So send us your questions and send your comments, and we will support you the best we can. Alyssa says she's a disabled nurse, so she has the experience, right, of being a healthcare provider and a stroke survivor. So she probably has a lot of unique perspectives. What other questions do we have? So we talked a little bit about how journaling helps. So expanding on that, using your hands, having a place for your energy to go, has been shown to help with that emotional, bringing that emotional activation down more than differently than just talking. So fiddling with things, we all talk about fidget toys and stuff like that, gardening, cooking, knitting. If you haven't tried it. I was a skeptic, but it kind of works. Knitting, crocheting, getting your hands busy is one strategy. And then, we hear a lot about meditation or breath work, mindfulness. Those things kind of get mingled together in the health space and wellness space. So, breath work is just intentional focus on breathing, where the pacing and the intent and all that is guided by the breath. Meditation is just a sustained focus on any repetitive stimulus that doesn't require conscious effort. So you can do meditation where you're repeating a word or a phrase. Sometimes you hear the word mantra, and you're just repeating that over and over. You can do it where you're watching a repetitive motion in nature. So you're watching the waves at a beach, or watching a water fountain, or watching a fireplace, because it's just a repetitive motion. Or you can even do a walking meditation, where you're not walking for the intent of exercise and getting your heart rate up. It's a route and you're just on autopilot. Those are all meditations. And when you find your thoughts deviating from that, you just go back to it. Go back to that repetitive stimulus, whatever you chose, whether it's the phrase or the walking or the watching things in nature. And then mindfulness is just being with yourself in the moment. So if you deviate, you deviate, and that's just the space you're in right then. So mindfulness, meditation, they all show benefits really quickly. You don't need to do an hour. You don't need to do half an hour, 20-ish minutes, even 5 minutes. I always used to tell people who are like, I'm just too busy. Like, if you have time to go to the bathroom, you have time to meditate. 1 to 2 minutes is all it takes. So that is definitely one aspect of emotional wellness that's talked a lot about, but it doesn't have to be the core for you if it doesn't resonate with you. Again, you have to meet yourself where you are. I think it's always, in general, it's great to practice and trial different things before you actually need them. I used to tell all my patients before this job that it's easier to learn about fire extinguishers when you're not actually on fire. So trialing different strategies, having your toolbox ready to go so that when you actually need it, the stress of finding something is not added to the stress you're already feeling. You've got your toolbox, like, these are the sounds I like to hear. These are the smells that are soothing. This is my comfortable blanket. This is where I, can actively, regulate and calm down, versus these are the things that amp me up. So having your toolbox. I think, YouTube, Google, there are so many free resources for supporting emotional wellness. You do not have to spend money. You do not have to, go to a so-called trainer. Just Google 5-minute wellness video. Google, 3 minutes to relaxation. or daily strategies for emotional wellness, and you will find so many resources, and try them. Take advantage of the resources that are out there. That doesn't mean that every day, you also don't want every day to be like, some days you just want to be in your feelings, and they're not the good feelings, and that is okay. Again, as long as it doesn't last for an amount of time that interferes with your daily life, and you're keeping yourself and others around you safe, then, feel your feelings. And it's okay to have a day to mope. I just had them. Okay. Let's see. Alyssa says, occupational therapists have been a knitting toy, but we have kitty since July. Are you talking about knitting, or are you talking about a cat? Let me know, Alyssa. Deborah says, this month is 2 years after the stroke for me. My vision and balance have been affected. My left side is the affected side. I'm left-handed. I try really hard to stay positive and grateful, but it is hard sometimes. I try to journal, and that is a challenge too. Thanks so much. I'm grateful for this too. I'm in the Chicago area. Yeah, stroke affecting your dominant side is a whole nother level. I think the writing, and I'm glad you mentioned that, because there are ways to journal without actually writing. So you can record on your phone. That's an option. Or if the actual writing motion is something that is soothing for you, you can do that motion for coloring or doodling, and then just record your thoughts. So you can kind of combine them. But absolutely, having your affected side be your dominant side is a whole nother challenge. There is a book called One-Handed in a Two-Handed World, and it's written by a young woman who had a brain injury, or it's written by a woman who had a brain injury when she was very young, and she kind of talks about all her experiences of figuring things out one-handed, including butchering a chicken. So I don't know how much that's relevant to you, but I think it really speaks to her resiliency, and that, it is what it is, and don't tell me I'm not going to be able to do it just because it's one-handed. But I think it would be worth checking out from the library, just to kind of share a little bit in her experience. Not that it's the solution to anything, and not that it's going to make all the challenges that you're experiencing go away, but it is nice to hear from someone, or to have information from someone who can relate to that experience of being one-handed in a two-handed world. Okay, Jill says, thanks. You're welcome, Jill. Alyssa has a safety chair in her shower. That's great. I think chairs are great. If a fall is going to happen, statistically, it's going to happen in the bathroom, and in the shower with the heat and the humidity, and you're tired and it's wet. It's just it can be a tricky situation. So I'm all about safety chairs. Alyssa says, I also have seizures, so I have a cane, and I had some physical therapy. And her first stroke was months after I turned 30. So yeah, young. I think we all, our emotional wellness, just like any other part of our physical or our brain and bodies, it changes as we age, right? Children cry and throw tantrums because they have a limited way to communicate that they're needing something or wanting something, or that something's uncomfortable. And then we have, the strategies that we learn from our parents in terms of how we take care of ourselves, or do we talk about feelings, do we not talk about feelings? And then a lot of us go into the workplace or into school, where we kind of mold how we experience our emotions and process based on what everyone else is doing. And then we reach a certain age where we start to care less about that stuff and come more into our own, right? And then you add the stroke experience, depending on when you've had it. Having it before 30 means your emotional toolbox and your emotional experiences are a lot different than someone who has a stroke, let's say, as a child. You know, children with sickle cell disease have silent strokes all the time, and they have them when they're super, super young. Or emotional wellness when you're older and you have a stroke. You know, you have kind of settled into your life in a way. You've gone to school, you've settled into your job, you're retired if not, you're having some health conditions related to age, and then you have a stroke. That's going to affect your emotional wellness differently. So definitely, again, I think meeting yourself where you are. Okay. Jill says, navigating everything alone is exhausting. I didn't know about the American Stroke Foundation. Yes, that is a very true statement. It is exhausting. Taking care of your health and navigating the system is exhausting in itself. And then when something happens to you that changes your endurance for things, that's exhausting. And sometimes getting better, the process of getting better can feel really lonely. So if you can find the support, even just one person, you know, to kind of, or one outlet to kind of give yourself space for that, I hope that will help manage the feelings that you're experiencing. I'm glad that we could introduce you to the American Stroke Foundation. I think community-based programming that focuses on brain and body health, working and talking with other stroke survivors, really approaching things from the neuroscience of the brain. Those are all things that we have together, and I hope it's a model that can be expanded so that everyone has that support. Talking to and working with fellow stroke survivors to work on brain and body wellness is a very different, very distinct experience than working with a medical provider. They both have their benefits, but eventually you have to get back to life, right? And back to life doesn't mean that your progress is done. Back to life just means that you're living your life, and in the context of living your life, you're continuing to work towards your wellness. Okay. The last treatment for children is important. Alyssa said that. Kylie, what if I'm in a rural area and don't have any support groups listed in my area? So give us a call or email us, and we will help you in finding someone that you can talk to. So we have sometimes, or I have sometimes done like phone trees, where we tried to get people engaged in virtual or online, and for whatever reason it didn't work out, but they were able to get linked up to someone who wanted to use their time to kind of talk about their stroke experience and kind of share what the knowledge they've gained with other stroke survivors. So let us know what you need and let us know the challenges, and we will do our best to support you. Deborah says, I can't get to the support group finder. Help. Kylie, send the link again. So Deborah, if you're I'm assuming you're in front of the computer right now, Google American Stroke Association support group finder, and it should take you right to that page. Okay. All right, we're getting ready to wind down, so last call for questions and comments. Circling back to what we said at the beginning, sometimes emotional health falls secondary or falls to the wayside when we're focused on our physical recovery and function, but it is an equal part in our wellness journey. And if we are not taking care of ourselves emotionally, or people around us are not taking care of ourselves emotionally, it will show up in your physical function and recovery and outcomes. You can't separate the two. That being said, early phases of recovery or being in the hospital, you don't get a lot of time, right? It's about insurance, it's about getting you to a level of function or training your caregiver and discharging you. So there is not always time and space for that emotional support. That being said, you can still ask for it, and also, let your caregivers know that that is part of like your post-discharge health plan, and make your team work for you. But that is also kind of ties back to what I said about learning about fire extinguishers before you're on fire. Like, get your team in place. Do you have, is spirituality a big thing? Is there someone, at your church that, you can confide in or talk to? Is there a family friend? Is there someone older than you? Is there someone the same age as you? Is there someone that's a mental health professional? Like, who are your wellness people? It may not even be a person. It could be a dog, But get your team in place. All the top performers in the world will tell you, and they will not hesitate to tell you, that they are not lone wolves. They don't operate alone. Everyone that performs at their best and feels their best has a team of people behind them. So get your team. Okay. Last minute questions and comments. We're winding down. So next week, we will have a live Q&A about transportation considerations after stroke, or transportation challenges. So we will go over getting in and out of a vehicle. We can go over loading and unloading a wheelchair from a vehicle. And depending on our time, we will also go over some adaptive equipment for driving. And please start thinking about your questions, anything that you've experienced after a stroke related to driving or transportation. You're free to submit those questions and comments ahead of time, but we want to know how to best serve you. So let us know what worked for you, what didn't work for you, and so we can share that information with everyone else that's joining us. And we will kind of go over that stuff, show the information, show those videos, and then have open for questions and answers. So I know those challenges are, I know there's a learning curve for those, and sometimes the education you get is kind of like a drive-by, oh, you're being discharged, okay, well, good luck, throw the wheelchair in the trunk. But there's the way of just getting it done, and then there's a way that in the long term will save your energy, and save your body and protect your body, and make things more efficient, and so that you have energy left and time left for things that are more meaningful. And that's what we're going to work on and talk about is strategies, obviously with feedback from you guys, because you probably have solutions and strategies that are better, are just as good if not better than people who teach them. So please let us know. Okay, Deborah, I will send you the link individually after this. Sylvia says, just logged in, 2 years post-stroke, physically better, but yeah, mentally lots of help needed from the beginning. Still much anger. Yeah, that's a big part. Your life changed in a way that was not under your control. So anger is, it would be weird. Weird is not the right word. It'd be unusual if anger wasn't part of the process. Alyssa says, soon I will use for an appointment in Philadelphia. Alyssa, I'm not sure what you're talking about, but I will get back to you if you comment after we're done. Okay. So thank you everyone for joining. Emotional health is important. Take care of your feelings. Feel your feelings. All feelings are valid. It's how they impact our day that matters. And we'll see you next time for all things vehicle related. Have a good day. Take care.